Hello everyone, welcome to my channel Icons of Nursing. So today we will discuss NORCET 2022 SIFT 2 memory based question. So it is not exact as you are getting questions in exam, but we tried our best to cover memory based and recall based question. So let's start with the question number 1, that is farmer's lung. Option A, coal dust, cotton dust, sugarcane dust and dust contain actinomycetes and biological organism. So answer will be D. Farmer's lung condition is associated with intense or repeated exposure to inhaled biological dust. Second question, Vice President of India, that is Jagdeep Dhankar. Option third questions, that is dusky hue appearance or bluish discoloration of the vagina, vulva and cervix. So it is seen in the Chadwick sign. So also we can say the Jacquemer sign. Fourth question, that is most common leading cause of death in newborn. So I am not getting the proper options here. So next question, that is they have asked the relative risk formula. Sixth question, that is suicide rate per year in India. About 80 lakh people die by suicide worldwide everywhere. National suicide rate was 12 calculated per lakh of the population. Seventh question, in case of burn, Wallace rule of 9. So rule of 9 is estimated for what? It helps to estimate the body surface area into the percentage in case of the burn. Here you can see the both the upper limbs and the head we are giving the 9% and 18% front and back, and for the both the lower limbs we are giving the 18% and 1% for the perineum. Next question, 8 number, that is modified radical mastectomy is the removal of. A modified radical mastectomy removes the entire breast. It contains breast tissue, skin, areola and nipple and the lymph node. Ninth question, that is infusion rate in case of child, that is 4 mg per kg per minute. 10th question, that is what will be the diagnosis if patient having the painless vaginal bleeding after 20 weeks. So answer will be placenta previa, that is painless vaginal bleeding will be seen in case of the placenta previa. So 11th question, that is why TPN, total parenteral nutrition, is administered through central venous line. So option A hypertonic, B hypotonic, C isotonic, D none. So I think answer will be hypertonic. 12th, immediate care need. There is given one scenario and they have asked regarding the color of the trials in case of the patient need the immediate care. So red color trials will be given for the immediate care need. So here you can see all the 4 colors of the trials. So you can learn the color of the trials color code through the as you are playing the Ludo. Okay, so in case of the Ludo we have red, yellow, green and blue color, but here in trials blue color is replaced by the black color. So immediate care we are giving red color trials, delayed for yellow and minor for green and black for the decreased. Next question, that is 13, regular insulin rate set for the regular infusion rate set for the administration of TPN leads to the complications of. If you will not maintain the regular infusion rate during administration of TPN, what will be the complication occurs? So option A, that is glucose alteration, B electrolyte imbalance. So I have not got the proper options here. So next question, risk factor for schizophrenia includes all except A, family history of schizophrenia, B, birth complication, C, woman and D, birth in the winter season. So answer will be C. Schizophrenia is more common in the male, not in female. So other all options is related to the risk factor for the schizophrenia. Next question, 15th, what will be the cause more complication, which vaccines among DPT vaccine which will cause the more complication? So option A, diphtheria, B, pertussis, C, tetanus and all three together. So according to my view the answer will be pertussis. So it will cause the some of the neurological complications it will seen in case of the pertussis. Next question, treatment of mania includes all except option A, haloperidol, B, oxycarbamazepine, C. sertraline. So answer will be C, because sertraline, that is SSRI, so we can use mainly in the antidepressant case. 17 question, that is viral hepatitis as in obstructive jaundice, levels of AST and ALT ratio. So we have to identify what will happens with the AST and ALT ratio. So here we can see the AST, that is full form stands for aspartate transaminase, and ALT alanine transaminase. These both are the liver enzyme. So in case of the viral hepatitis, here you can see in the second one, the ALT will be more as compared to AST, and next in case second last, that is obstructive jaundice, rarely the ALT value will be increased more than 500 IU, and in both case of the in case of the viral hepatitis and obstructive jaundice, there will be increased bilirubin level. So next we will move towards the 18th number question. Physical quality of life index includes all except A. basic literacy rate, B. infant mortality rate, C. life expectancy age 1, D. per capita income. So answer will be per capita income. 19th number, which test is used or designed to determine whether vaccine has been affected by freezing or not. So we are doing the SEC test for determining the vaccines is affected by freezing or not. So next question, 20 number, 4A of schizophrenia includes. 4A of schizophrenia includes affect, association looseness, autism, ambivalence. So 21 number questions. Next question, 21. A husband diagnosed with the infertility. Which diagnosis at the birth will helps to diagnose the infertility in later stage? So measles, mumps, rubella or toxoplasmosis. So answer will be mumps, because mumps is related to the orchitis, and it will help leads to the shrinkage of their testicles, and it will decrease the sperm count in the male. So it may leads to the infertility. Next question, 22. Negative symptoms of the schizophrenia in which decreased motivation towards daily activity. First option, alogia, anhedonia, evolution, and association affect. Answer will be evolution. A lack of motivation or reduced drive to complete goal directed activities. 23rd question, that is IPL cricket team logo. So there is given one logo for the I think Chennai Super King or Mumbai Indians, some logo is given. So we have to ask regarding the next logo. We have to identify which IPL team logo is indicated. So answer will be Sunrisers. 24th, Maharashtra. In Maharashtra, Aurangabad name is renamed as. In 2022, nowadays there is so many places name is changed. So in that only the in Maharashtra 2 places name changed. Aurangabad name changed as Sambhaji Nagar, and Osmanabad will be Dharasiv Nagar. 25th, people who have had a total gastrectomy. People having the total gastrectomy and will develop the pernicious anemia. So need to supplement their diet with regular, option A, vitamin B12 injection, vitamin B oral intrinsic factor, and C, folic acid supplement. So answer will be vitamin B12 injection, because if patients having already total gastrectomy, so total removal of the stomach part, so in that case there will be deficient of the vitamin B12, because vitamin B12 deficiency will leads to the pernicious anemia. So best method to give the vitamin B12 through the injection method. We are giving IM injection method, so it will absorb through the gastrointestinal tract is deficient, because oral we can't give. So rather than oral intrinsic factor giving, we are giving the injection method. So answer will be A. 26th, incidence rate best measured and calculated by, option A, cross sectional study, cohort study, case control study, retrospective study. So cohort study allow you to calculate the incidence of the disease in exposure group. So you can calculate the absolute risk, incidence risk, and relative risk ratio and rate ratio. Next question, 27. India has banned single-use plastic items like plates, cups, straw, trays and polythene from which date? So India has banned the manufacture of all the plastic single-use plastic items from the July 1st, 2022. So next 28, that is image based question. So many students are confused between there is given which image is there, either Devers retractor or Harrington retractor. So the given image, that is for the Harrington retractor. So here you can see the Harrington retractor, and here you can see the Langerbeck retractor. You can learn the Langerbeck retractor through the L, the first letter L. So the retractor is also looks like L shaped. Devers retractor you can learn through the question marks sign. Okay, so in case of the Devers and Harrington retractor, the both looks like same, but only the difference at the tip of the retractor we can see the little bit difference in case of the Harrington retractor and Devers retractor. Next, that is Doen's retractor. Here you can see the image in Morrison retractor and Zerny retractor. Zerny retractor looks like Z shaped. So C is silent in the Zerny retractor. So Z stand for Zerny. So it looks like Z. Okay. So malleable retractor next, and mastoid retractor, and at last you can see phenochet four blade retractor. Next, that is identify the rash. So given rash, that is for the chicken pox, because chicken pox rash, that is pleomorphism rash. So it includes all the stages of the rash in the same at the same time. So it is characterized by the varicella, papules, vesicles and pustules. So all stages of the rash is seen with the crust formation. And in case of the chicken pox, the rash starts all over the trunk area like chest, back and face, and then it will spread over the entire body. Next image is given for the BP handle. It is also known as the scalpel handle, or we can say the blade handle. Okay, this is Bird Parker handle. Next we will see the 32 questions. French in catheter indicates. French, in case of the catheter, French indicates either outer circumference, inner circumference, diameter or radius. So it indicates the outer circumference of the catheter. Next question, cannula used for the blood transfusion, that is 18 gauge cannula we are using, that is green color cannula we are using for the blood transfusion. 34, that is IM injection needle gauze. So IM injection needle gauze, that is 22 black color needle we are using for the IM injections. And one more question regarding the IM only. So it has asked the IM injections given at which angle. So that is 90-degree angle. So you can say that for the IV injection we are giving IV at 25-degree, intradermal at 15-degree and subcutaneous at 45-degree. Next, that is site for the IM injection in 2 years. Site for the IM injection in 2 years we are giving most common site, that is less than 2 years we will use the vastus lateralis site. 36 question, in grey color vial what we added if we want to collect the sample for the sugar test? So answer will be sodium fluoride. Sorry for the options, I have not included the sodium fluoride. So answer will be sodium fluoride we are adding in the grey color vial to collect the sample for the sugar test. 37, best method to give iron dextran injection, that is Z-track technique we can use for to give the iron dextran injection. 38, most common cause of the neonatal mortality in India. Option A, prematurity. Option B, birth asphyxia. Option C, congenital malformation. Option D, neonatal sepsis. So answer will be prematurity. Complication of prematurity is the most common cause of neonatal mortality in India. 39, who is the Chief Justice of India 2022? So Justice Uday Umesh Lalit has become the new Chief Justice of India as he took his oath on 27 August 2022. 14th question, placenta discarded in yellow color bin. As we know that all the human anatomical waste is discarded in the yellow color bin. 41. Nasogastric tube discarded in the red color bin. There is given one scenario. The patient is getting the nasogastric feed from so many days. So now we have to discard the used nasogastric tube into the red color bin. Whatever the recyclable bin, all the tubings, catheters, we will discard in the red color bin. Next, 42. If BP blood pressure is given, so in the NORCET questions there is given different questions. Just I am trying to give the same as there is given one. So I am giving the examples as like that. So if blood pressure is given 130/90, what will be the pulse pressure? So formula for the pulse pressure, that is systolic BP minus diastolic BP. So 130 minus 90, that is equal to 40 mm of Hg. Next question, that is they have asked regarding the lumbar puncture position. 44th question, Nagaland direction in India map. So that is northeast. 45th question, they have asked the image based question. They have given this image. So here you can see the WHO analgesic ladder images. So here you can see that for the severity of the pain, according to severity we are giving the analgesics or NSAID. For the mild pain we are giving the NSAID, and for the moderate pain we will give the non-opioid analgesics with opioids, and for the severe pain. So here you can see all the things. Next, 46. Breastfeeding start in normal delivery. So in case of the normal delivery, we will start the breastfeeding within 1 hour of the delivery or as soon as possible. 47th. Difference between isolation and quarantine, they have asked. 48. Which is the first company who has made the COVID-19 intranasal vaccines? So answer, that is Bharat Biotech. 48th. Honey crust appearance rash. Honey crust appearance rash is seen in the impetigo and scabies. So this is the highly contagious skin infection. Here you can see it mostly affect the infant and the young children. It usually appears just around the face and around the mouth. So over 1 week the sores will be burst out and it develops as a honey colored crust. 49. That is trichotillomania. So that is also known as TTM. It is a disorder in which the patients, they will urge to pull their own body hairs. Okay. 50. Next question, that is at birth what is the first vaccine is important to give? So during birth the hepatitis B vaccine is the most important vaccine which we can give. Next question, Montex test PPD should be done within. So after giving Montex test we will give the PPD reading we will do within the 48 to 72 hours. And one more question regarding the Montex test only, PPD. So they have asked regarding the route. So we will give through the intradermal route. Okay, whatever the antibiotic sensitivity test and all the PPD injection we will give through the intradermal route. Next question, 52. If a patient is getting aminophylline, what is the action of this drug? So aminophylline is related to the dairyphylline classifications only. So it will comes under the bronchodilators. Next question, what is the complication occurs within 24 hours if patient having the femur fracture? If patient having the femur fracture, the most initial complication patient may develop, that is fat embolism. Option A, pulmonary embolism, fat embolism, or infection. Infection will be the later complications after surgery. If patient have undergone through the surgery, then the infection can be the complications. Next question, that is they have asked regarding they have given one scenario in which the patients having all the eye response, verbal response and motor response is normal. So they have asked the highest score of the GCS. So 15 is the highest score and 3 is the lowest score for the GCS. Here you can see we can assess the 3 mainly response in the GCS: eye response, verbal response and motor response. So you can learn through the EVM 4, 5, 6. Okay. So one more question regarding the GCS. They have asked like a patient who opens his eyes in response to pain. Okay, in question in NORCET they have given the different scenario, just I am giving the examples of like that scenario only, so you will get some idea. Okay, 55. A patient who opens his eyes in response to the pain in confused verbal response but flex to withdrawal from the pain has the Glasgow Coma score will be. So here you can see, if the eye opening will be spontaneously, we will give 4 score, to speech we will give 3, and if the eye opening to the pain we will give 2, and if the eye opening will be no response we will give 1. So in this questions 55, the eye response only with the pain, so we will give the score 2. So here you can see, eye response to the pain we will give 2 score, and confused verbal response, so we will, in case of the verbal we will give 4 score, and next question, that is flex to the withdrawal from the pain, so we will give the 4 score for the motor response also. So all together we can calculate 2 plus 4 plus 4, that is equal to 10. So answer will be 10. So thank you for watching the video. So thank you everyone. So you can share this video with your friends, and please like, comment and subscribe my channel. So whatever the left out questions you can comment in the comment box. So thank you for watching.